seeing so many teens coming in needing help with their mental health. But I think we know we are in a youth mental health crisis. A lot of it is coming in with the depression, with anxiety, and feeling very unsupported.
Sometimes the parent is also struggling in their own way. It can be overwhelming, it can be frustrating, it can be stress triggering.
If we think about the family as a system and a system's under stress, well, of course, it's going to impact the child as well. It's huge fights, it's wars, it's consults being broken.
Don't have children before you're healed, or first heal yourself. Am I doomed to be the bad parent and I have traumatized my child?
Some of us had terrible examples of parenting growing up. You can't rely on them. You're trying to do the opposite, but maybe you're overshooting. We don't give children enough credit in that they know something's wrong so much of the time. If you recognize that you've struggled with something, you acknowledge it and you get help. I mean, that is the most beautiful thing you can model to a child.
Hello, everyone, to Real, Raw, and Authentic. In today's episode, I'm going to speak to Dr. Jenkins. She's a psychiatrist and specialized in child psychiatry. Willow, thank you for being here today. I'm really excited to speak to you.
Yes, thank you so much for having me. What a treat.
Can you share a little bit more about your background and your expertise, please?
Yes, absolutely. So I am actually Canadian. I'm Canadian trained. And I work down in the United States as a child psychiatrist, as he said. I'm also an associate professor of psychiatry at UCSD, one of the universities here. So I do a lot of teaching. And in child psychiatry, I work in a few different settings. I work a lot in the hospital setting. I work a lot with children who have other medical illnesses. And then I work in Canada still and support a really rural Indigenous community as well. So I do a lot of different things, which is really fun and exciting.
That's incredible. So much work do you actually do. Thank you so much for all the work that you're doing. I think that's amazing what you're contributing. But I'm more curious, what brought you into your field of work?
Oh, it's such a good question. I always say that I didn't really choose child psychiatry. It chose me. So before I went into medical school to become a psychiatrist, I did a pharmacy degree. So I was a pharmacist by training. So I've always kind of worked in healthcare. And when I went into medical school, I really started doing research and working with a population of older adults who had like chronic schizophrenia, but also a lot of addiction and being unhoused. In the city I'm from called Vancouver, there's an area called the Downtown East Side, which is where people that are really struggling end up in kind of these single room occupancy hotels and things like that. So I would go to do research trials with them or to treat them. And every time I sat down and spoke to people, they would tell me how things had started way back when they were children, how either something had happened to them or that they'd had a really negative experience with mental health that put them off receiving help the rest of their lives. And so I realized in sitting with all of these people and hearing the same story over and over again, that I really wanted to be the person that could meet them first and hopefully prevent a lot of the struggles that I was seeing later in their lives. And so I switched, much to a lot of people's surprise, and became a child psychiatrist. And that's what I've been doing for the last, 10, 15 years.
Wow. Yeah. Would you say, because what you shared now is like you've seen stories of how trauma, how I hear it, is unfolding later on in life, how it shows up in adulthood. Would you say it is often trauma related?
I think I was surprised to realize how much it was. And when I didn't know when I first met a lot of these people, I assumed, maybe the predominant issue was addiction or substance use. And then hearing the stories and realizing it came back so much to childhood trauma and that things really got set off on the wrong way so early on in their lives that absolutely, I'd say trauma affected them so much. And when it wasn't addressed and wasn't treated, then really it has just such a huge, huge impact on all aspects of someone's life. I mean, you know this so well that it's something that I really saw and just couldn't ignore.
Would you, I'm always struggling with the whole definition of trauma because some people sometimes feel like, nah, it's not me. I'm not included in trauma because I haven't experienced it. But how would you define the word? What would you say? For someone, for example, who deals with addiction that you've met then, what were they mostly struggling with? Was it easy to identify trauma, or was it more like an emotional wound?
I mean, trauma encompasses so many things. And I always say it's not really what happened. It's really more what happened inside of you, like your reaction, what happens within your brain, more so than the actual act. Like I've heard people refer to trauma as trauma with a capital T or trauma with a little t, as if you quantify it. And I really pulled back from that because I don't think it matters so much exactly what it was or how someone else perceives the severity of the trauma. It's really the impact it has on you. And that impact can be so individual, which is why like some people experience one thing and end up doing okay. And other people really struggle with their mental health related to an event. So I think for the people that I saw, so much of it was, and so much of my work is it's not usually a single thing. It's been a complex, chronic type of trauma that's happened. It's not as clear as witnessing a car accident. It's a simple example. It's maybe something more insidious that happened in their family life where there was neglect, somebody who wasn't meeting their needs. A lot of that I hear is actually not so much what happened, but what didn't happen. And
these invisible wounds that only people feel.
And that's really what I sit with and try to help people with.
Going into your work, the work that you're doing now, you're working with children and teenagers, I assume?
Yeah.
What do you see? What's the most common thing that you see? Or is it the wrong thing to say even?
Well, common doesn't mean okay. But I mean, in terms of my work in the hospital, of course, so much of it comes down to depression and to suicidality and suicidal ideation. Those are the biggest things that I treat in a hospital setting, which makes sense because if you come to a hospital for your mental health, usually it's because there's some degree of feeling unsafe with yourself or unsafe with somebody else, right? Yeah. So that's not too surprising, but I think we know we are in a youth mental health crisis. And so we are definitely feeling that and seeing so many teens coming in needing help with their mental health.
Is there a reason why we struggle now with such a youth mental health crisis, or has it always been there and now we're more aware?
I think it's a good question. I think there's a lot of different factors and we're still trying to understand more. I mean, one clear one that gets talked about a lot is the impact of technology, the impact of social media, especially on teen girls. And, in terms of self-image, in terms of their moods, we have studies that show that there's links. Even just time on screens and how that takes away from other aspects of your development. And all of this in terms of technology has really picked up, in the last 10, 15 years for youth. So that has an impact. I think the other piece that I'm, equally passionate to talk about is the stress that families are under. And a study just got released within the last month showing that like mothers and their mental health is worse than it has been. And if we think about the family as a system and a system's under stress, well, of course, it's going to impact the child as well. And so here in the United States, the cost of living is so high. I meet parents who are working 2-3 jobs. They're barely seeing their children. And it's not to place fault on that individual parent, but we have a system that's really not supporting families. We don't have childcare that's covered. Maternity leaves are very short. And all of these have impacts on our children and their development. So there's obviously these factors like COVID, technology, but the one that I think we're not doing a good enough job of really identifying and addressing is the family stress.
And how does it show up in the children, that family stress?
Yeah. So a lot of it is coming in with the depression, with anxiety and feeling very unsupported, not feeling like they have a trusted adult in their life. Sometimes coming in just not feeling cared for, not feeling loved. And that's going to absolutely impact how you feel. And it's really sad because I sit and meet the parents and they absolutely do care about their kids most of the time. There's of course sometimes ones, that maybe don't for whatever reason, but the majority absolutely do, but they're just being pulled in so many different directions that they're not able to really be present.
So the parents are overwhelmed?
Overwhelmed, that's a great word. Yeah. Feeling very overwhelmed by all of the different demands. And parenting is just one of them.
And then the children are feeling left alone in this big world.
And unheard and unseen and misunderstood. All of these emotions, I think a lot of us can relate to as teens, but when they really are predominant or sit with us, they're going to have such a big impact, let alone throwing in a child who maybe already has another mental health struggle, ADHD, or a child who's gone through something traumatic, or who has a parent who has a mental health issue. It gets complicated fast.
It's quite, gets complicated. And for me, that immediately brings up, that's complex trauma. That's, again, that strong word that people feel like I don't have to associate with it, but trauma is integrating means that word. Anything that happens inside of ourselves that's just too much to handle, physically and mentally.
Completely, yeah.
Wow. But how does let's say, for example, depression look different in children and teenagers compared to adults?
Oh, I love this question because I think it is so misunderstood. And one of the biggest things that I see, especially in teens, is that their symptom is mainly irritability. They're really on edge. They're really irritable. And then if you're not aware of that, a lot of times they go, oh, that's normal teenage behavior. Aren't all teens really grumpy? And I'm always like, no, of course, like once in a while. But if you're pervasively irritable, pervasively on edge, that really indicates that you should look and understand more about what's going on for the child and see, could it possibly be depression? Because like I said, irritability is much more prevalent than, for example, sadness. You're not going to see a teen necessarily crying, with a box of tissues. They're probably going to be snapping or arguing or yelling.
Yeah.
That would be more common symptom in teens.
So it shows mostly the emotion of anger towards, let's say, the parent?
That's what I've been seeing. Yeah, definitely more the irritability, and then the conflict with parents is key, but it also comes up with teachers, being a little bit more oppositional. And then withdrawing, not doing the things they used to do, changing friend groups, not hanging out with friends. These are all things we really see in the depressed teenager, unfortunately, and really isolating in rooms, spending a lot more times on screens. These really can be signs that something's not going well, but it's hard to tease out on your own. So I always suggest, if you're worried, bringing a child to see a professional.
Is that exactly what you would advise for someone who sees, and maybe you relate right now as a parent, and you're like, oh, this could be my teenage son or daughter or my child, that you would say, bring them in for evaluation? Or is there something the parents can do by themselves to start with?
Yeah, well, it depends on your relationship. I mean, of course, if you notice something in your teenager, I always advise to talk to them about it. Make sure you pick the right time, though, a time when you're both not going to be interrupted. You can really put things down and ask them very genuinely how they're doing, and coming from a place of caring and concern, and hear what they have to say, because maybe there is a clear answer. But I find for a lot of parents, those conversations are really challenging, and then they worry, am I going to miss something? Are they telling me everything? And accessing a professional to help can be so invaluable, because it's hard to talk to your parent. And being able to talk to someone that is safe, trustworthy, not going to tell your parent everything you say, you really can learn a lot. So if you have the access and the ability, which isn't something everybody has, to see a professional, whether it be at your school, a school counselor, seeing a psychologist like yourself, a therapist, taking your child to see their pediatrician can be an amazing first step. Pediatricians are great gatekeepers for mental health services here in the US and help direct. Those can all be great places to start.
Oh, that's good advice. That's wonderful advice. I like that. You also mentioned that you treat kids with ADHD.
Yeah, I do.
It's such a label that's thrown around. Let's say, I feel like almost a sort of a trend, vibe. Everyone seems to be, and that's again no judgment, but everyone seems to say like out loud, and I'm happy we can maybe normalize it, but I have ADHD. Sometimes I feel like I also have ADHD.
Sure.
Is it like something that's now negative? Is no problem? Is it neutral? Because school systems have not catched up yet, so it's a little bit labeled as special needs, support needed. What do you say now in the modern world these days? Is it a thrown around label, or is it something that we should just normalize and live with and learn to live with?
Oh, that's such a good question. I mean, I think there's so many layers to this. I mean, I appreciate all the awareness. I think when a topic is trending, or however you want to put it, it gets more people talking about it. And ADHD certainly has been that. I think since the pandemic, it rose in trending keywords on the internet, and everybody's talking about it, which my perspective is that's wonderful. Now, of course, everybody who maybe relates to a video or an article at ADHD, of course, isn't going to have it. There's so many other reasons people can have difficulties with their concentration. One of just being that's a normal human experience. Trauma causes difficulties with concentration, depression. I mean, almost every type of mental health concern and some physical concerns can cause issues with concentration. ADHD is definitely the one that is more socially acceptable right now. And I think that's something that I'm kind of struggling with, because it's definitely an illness, like you said, people are very open about right now, which is wonderful. And I wish all mental health concerns were like that, because it is one of the ones that I feel like it's okay to say you have. And I wish it was okay to say I have PTSD, I have depression, I have generalized anxiety disorder, I have bipolar disorder, whatever it is. So I've noticed that definitely ADHD has been one that people are much more comfortable sharing about. And that's a great first step. In terms of like the school systems, I don't think there's been some concern like, oh, is it being overdiagnosed? If somebody is going in to see someone like myself, a psychiatrist, somebody like yourself, or a pediatrician, or someone who's very trained in this diagnosis, I don't think anybody's overdiagnosing it. We have a very clear way that we go about determining if somebody has ADHD. It involves talking to teachers and talking to parents and doing questionnaires. And there's even more advanced, of course, testing you can do if needed. But I'm not so concerned about children being overdiagnosed. I think, like you said, though, now that we have more recognition, how are we going to support those kids? And that's a big question.
That's a very good take. I actually agree with that. How do you think that's where a lot of people, they send me messages, maybe you receive them too, is like, how do I know the difference? If it's trauma, if it's ADHD, I think because my content is very much trauma related, but then I get a lot of times, but that's also ADHD. And I feel like this is a sort of loop that keeps on happening. People are like doubting, what is it? Is it important to know?
I mean, sometimes it's very clear if someone had ADHD and you do a history and you hear, okay, they had struggles in early elementary school, and then you hear about a traumatic event later in life. And, and then some trauma symptoms come in, you can go, oh, potentially both are present. Of course, it gets more complicated when somebody's talking about early childhood trauma or early childhood neglect, and then trying to tease apart that versus symptoms of ADHD. But I think a lot of times that's when it is so important to see a professional and someone really skilled in the assessment, because of course there are differences in the symptoms. And sometimes it is clear. I meet a child who's had an ADHD label and the treatments are not working. And I talk to them and I hear about their background and I go, oh, my goodness, this isn't ADHD at all. This is a very complex trauma picture. We need to address this. And lo and behold, then we get some therapy, we get some good treatment in place, some better understanding, and the child improves. And then we go, okay, well, by following this child over a period of time and trying an approach, it becomes very clear that wasn't the diagnosis. But sometimes it is both.
How do you, for example, approach, because in adult therapy or also in psychiatry, it's very different than with children, I assume. How do you approach a child where you notice, there is maybe, let's say, childhood trauma, that complex trauma? How is the treatment? How is it going to look like then?
Well, I think one thing is to remember, especially with children, that their symptoms of trauma, of course, look different than in adults. They might not have some of the more clearly associated symptoms like the re-experiencing, the flashbacks, the nightmares, the ones I think most people kind of associate with trauma. Yeah. They may have more of the irritability, difficulties with regulating their mood, trouble sleeping, or the one that I think people miss a lot is losing their development milestones. We call it regression. So maybe they were able to have some skills, let's just say toilet training as an example, and then they don't have that skill anymore. And that developmental regression is something that we see in childhood trauma. I mean, I know you know this, but I think sometimes people don't realize that those symptoms are associated with trauma, and to know then, oh, maybe we should clarify what happened to that child or what was their story. And could that be a factor in a child's situation? Because they don't always tell you. It's usually shown through behavior, I guess is what I'm trying to say.
What's the earliest age you can start treating a child?
As a psychiatrist? Oh, this is so funny because people ask me this all the time. As it's not related to trauma, but we actually work in the neonatal intensive care unit. So we work with premature babies who have a condition called delirium. So when they've gone through a severe medical illness or received different medications, they have kind of a state of, an easiest way to say, a state of confusion called delirium. It happens in adults as well. And it's something that a psychiatrist are quite good at treating. So they'll ask us to come in to help with premature babies. So I treat very, very young is the answer. But that's a little atypical. That's really more in that very specific situation of a very medically ill infant. But typically, probably the range is normally toddlers, I'd say, is then when we start to see some of the challenges coming up.
Is that also, let's go specific to the ADHD, where it would start showing in the toddler years?
Yes, you can absolutely see some signs of ADHD in toddler preschool age. I think because there's such a wide variability in children at that age, and also the expectations usually aren't quite the same as in a structured classroom. A lot of times that doesn't get picked up But absolutely, there are some cases that I certainly have been involved with of children who just have very, very clear ADHD at the age of 4 or 5, let's say. And then there's great treatment and ways to do that. And it's not always medication. The treatment for ADHD, especially in young children, is usually looking at other strategies first.
What would they be, for example?
Yeah. So one of the kind of mainstays is obviously like parent training. And helping parents know how to help their child in the home environment. So by having things quite structured, learning how to communicate with a child so that they're not overwhelmed. The classic is if, you ask a child with ADHD to do 3 different things, they're going to forget by the time you finish speaking. So making sure you're giving very clear single ask demands, making sure that when you talk to a child, you're really capturing their attention. You're looking at them. Some people say like a light touch can really help. So these are just some examples of some of the tools you can learn as a parent to help a child with ADHD to really set them up for success. And then, of course, ensuring all of efforts are done to really preserve their confidence. So I think that's one of the things that makes me the most sad about seeing children with ADHD is sometimes they've had so much negative feedback that it really starts affecting their confidence and their sense of self. And so whatever you can do early on in life to really preserve that and find ways that they can thrive and skills that they have that really you can develop that are very positive, I think can be so helpful.
Oh, that's wonderful. I like that one where you really have the small things in your home and your parenting style that you can actually support your child. Because a lot of times, and that's you mentioned that negative feedback, they sit with major anxiety, insecurities. How can someone who's maybe already at that age now tackle this?
I think, well, obviously it's never too late. With being a child psychiatrist, I have the most hope because I see remarkable turnarounds. So I never think it's ever too late. I never think it's too late for an adult to get treatment. So just going off that kind of philosophy, I think there's always hope. And I think for teens too, if they've gotten to a place where they've really started to hear a lot of the negative feedback, is one, if it's coming from someone in the home, if you're able to address it directly with a parent. And something as simple as like every time you give a correction, make sure you've given 4 times as much positive praise, and something, it's very concrete, but it can be really helpful because you're like, oh gosh, I have corrected my child. I haven't said very much nice things about them today. And that makes a huge impact, just communicating it and saying like, I really appreciate how you played with your brother. There can be so many different things that you can say that can be positive to make sure your child's hearing that. And it's never too late to correct that. Making sure they have an interest and that you really help develop and support it and kind of rally behind it. And children with ADHD usually have tons of interests.
Yeah, is that so?
Yeah, I feel like they do. They have, the hyper focus sometimes get into things. So Legos is kind of a classic example, maybe somewhat stereotypical. But then, you can talk about Legos and share your child's interest as much as you can. If they're into a sport, obviously, then, going to the activities and trying to be as involved. Because unfortunately, for a lot of children with ADHD, the negative feedback does come from the school system, I guess is what I mean. So if there's things outside of school, extracurriculars, or things that are more inclusive your child can be a part of, that can be so helpful for rebuilding some confidence.
I like that. That's very helpful to find that support outside of the school system.
Yeah.
Where you can strive and feel like you're more succeeding in a way.
Yeah, there's like robotics clubs here in the US. We have like Boy Scouts and Girl Guides and all of these different kind of group activities, which can be so nice and generally can be fairly inclusive and accepting of children with differences in whatever it might be.
Is it true that you can outgrow ADHD?
I don't think so.
Because there was this thing that I heard once and I was like, oh, can you outgrow it?
I think it changes. I think that's kind of the biggest thing. And we're learning more about this. There's more and more research being done because you're correct. That used to be a thought that, you no longer had it. And one of the things we do know is that the hyperactivity piece of ADHD, that kind of go, not being able to sit still, fidgeting, that a lot of times that reduces as people age. So it's the very visible signs of ADHD that reduce, or a child has learned skills to manage or, the word mask some of the symptoms of ADHD. So they've been able to compensate for it. But when we look into it, a lot of those core symptoms, the difficulty with focus, the difficulty with emotional regulation, some of things like rejection sensitivity, which a lot of people have heard of, a lot of those core symptoms are still present. And it is really helpful, people find, when they're able to address, treat, and understand.
Why do they have the rejection sensitivity? Is it something in your brain?
Yeah, it's an area we're learning more and more about, but feeling really, really sensitive to rejection, especially interpersonal. So from other people, or like perceived rejection. It's been described as feeling almost as intense as a physical wound. I mean, of course, nobody likes to be rejected.
No, of course.
That's something I think we all try to avoid. It's not really a desirable thing. But for people with ADHD, it can feel so intense. And like, perhaps if you don't have ADHD, you experience a rejection, you kind of move on. But that person with ADHD may sit with it and be dwelling on it and feel so physically and emotionally hurt. It's a much more extreme reaction. And
does it stay in adulthood as well when you have adult ADHD? That's these invisible, maybe things that are happening that we don't see?
It's absolutely correct that it's the invisible things and the things that aren't seen, which is why when people were reading more about the symptoms, I think it has really been people relating to and understanding it on their own. And I think that there's been a lot of question about that, like self-diagnosis, but people are consuming content and realizing, oh, that does really fit with what I'm experiencing. And other people might not see them that way. But actually with ADHD, that makes sense because those external symptoms are the ones that are less obvious in adulthood.
But when for example, or when you identify yourself with the ADHD symptoms, what's then the next step to do? Because then I'm like having the awareness, okay, I am struggling with ADHD, maybe I've been my whole life. What can people do then as a next step?
Well, there's online screeners, so you can take a formal screening assessment online as another kind of like step in seeing if this fits. But again, I do really think it is important to talk to a professional about what you're experiencing, to have somebody else kind of help you with making that diagnosis of ADHD. Because for the reasons we've said, a lot of the symptoms do overlap with other things that could be going on. And you wouldn't want to say to yourself, oh, I have ADHD, and not recognize, oh, actually, I have PTSD or I have complex trauma. That could really set you on a very different path. So I think it is important for people, if they do feel like, oh, a diagnosis resonates with them. And like I say, if it's possible to talk to somebody that's a professional that can really help them go through their individual situation, because there is a lot of nuance in these situations that's really hard just as an individual to understand about yourself, or just to read from an article or do a screener. There's a lot that comes down to sitting with someone and really going through things.
Did you also notice, like in people with ADHD, for example, maybe child or adult, that they're more than, let's say, a person without ADHD on screens and social media or gaming?
Yes. I do find that especially my patients with ADHD do struggle a lot with screen time and regulating their screen time. And it's one of the biggest struggles that parents come to me with. I cannot get my child off the video game. It's huge fights. It's wars. It's consoles being broken. Like the levels that things can get to in homes over conflicts over screens can be incredibly intense. And I think there's some reasons for that I can share.
Yeah, please. Please, I'm curious. Yeah.
So I think one is that we know that with an ADHD brain, they're very, very sensitive to rewards and very, very reward seeking. And so much of screens, particularly video games, are really designed to capitalize on that, providing rewards, the dopamine hit to the brain, right? And so if an ADHD brain is really, really craving that and the screens are giving it to them, it's going to make it harder for them to distance than other children. And also because screens have really developed this type of reward, it can make other activities not seem as enjoyable, which is, I think, where the real difficulty lies. Because as a child psychiatrist, I don't think no child should be on screens at all. I think it's the balance. And if your child can play an hour of video games a day, and then they can go play soccer, they can go meet up with some friends, they can help cook dinner. That's a really nice balanced life for development. But a lot of children are coming in saying that they go to school, they come home, they sit on their video game console until they go to bed. And I just think, gosh, there's so much that's not happening that would be so helpful for your development and so helpful for your brain. And so working with families on strategies to help with that can be one of the most challenging areas of my work, to be honest. So it can be really challenging.
I
for
can
kids.
imagine.
Yeah.
Is there a practical step that parents can do? Because I feel maybe a lot of parents can relate.
I think if you know you have a child with ADHD already, just having that awareness when you are introducing screens. I'm always about prevention. So, if there's a way that you introduce it in a very clear way with a very clear plan, it's going to be on the weekends for 2 hours. What's going to happen if that isn't met? This will be the consequence. There's family media plans you can get online to really help be very proactive before they're introduced, which I think is really nice because then it's not in the moment making a decision or saying, you need to get off your screen now. And the child's like, what? You never said this. And that just creates more conflict because it feels very unfair. So if there's a way to front load some of the conversations and what the expectations will be, that's really key. Keeping screens out of bedrooms is, I think, so helpful because that's a child's private place. And then when the screens are in there, as a parent, you have limited control over them. So I suggest that parents, if you're able to keep the screens or the devices out of the bedrooms, that is a true goal. I know how hard it is, though. I don't say any of this saying that it's easy. And talking to your child about kind of what they envision too and their goals are. I don't want to minimize the importance of hearing what your child gets out of screens and what they're enjoying and validating that. And then working with them to think, are there other ways you can get some of the things that you're getting from screens in another avenue? Because as adults, it always feels like we're telling kids what to do.
Yeah.
But if there's a way to involve them in the decision making and hearing from them, then whatever plan you come up with usually goes better.
That's good advice. I like that. I need to dive into the consequences because we're this time I feel a little bit our generation is maybe like this. We are more aware of maybe, let's say, not to blame our other generations before us, of what didn't work in terms of consequences. So what does actually work? What's a good consequence that's not, and I'm going extreme, to traumatize my child?
Of course. I think that's the fear because I do think even the word consequence or boundary makes a lot of us kind of stiffen up because perhaps we had some very difficult parenting ourselves. And so then, of course, you're like, oh gosh, I don't want to repeat any mistakes. But I do think it is so important. Children really thrive with structure, with predictability. And in terms of the answer to kind of a consequence, it should be a natural consequence. It should be linked to the activity. So let's just say the child, you'd agreed 2 hours of video games on Saturday night. They refuse, they've gone over. Well, then a natural consequence would be, okay, well, there's not going to be video game time tomorrow. You showed me that you weren't able to manage the time very well. We'll try again. And see if you're able to manage your time. You wouldn't then say, oh, I'm going to not let you go to the movies with your friend later. That's not a linked consequence. That doesn't make sense as an example, right? You'd want the consequence to be linked to the activity. Otherwise, rightfully so, a child feels like, what? That's nothing to do with it. That's so unfair, mom or dad. Why would you do that? But if it's a linked thing, then it makes a lot more sense. And especially if you've told a child ahead of time, you've prepared them that might happen, then it's just very clear. Very matter of fact. It doesn't have to get too dramatic, hopefully. But yeah, that would be my advice.
So to really say, okay, beforehand, you get 2 hours. If you go over time, then there's tomorrow, no gaming, but you can introduce it in the day after?
I think so.
Again?
I mean, yeah. And whatever works best for you. There's no real prescription here. It's just a matter of deciding what feels right to you, what amount of time with screens you feel good about as a family. What some families prefer a little bit of time every day. Some families prefer a little bit more time on the weekend. They feel like that's easier to manage. It's really can be quite individual, but I always believe in giving children a second chance. And that's what I say about having it very clear ahead of time, because it's understandable. You might be playing a video game and not want to get off. Then if okay, well, if I don't, I'm not going to get to play tomorrow. That's motivation. And okay, mom and dad are going to follow through. I actually won't be able to, which is another thing. Sometimes as parents, we make a lot of threats, for lack of a better word, and then don't necessarily follow through, which then really undermines the whole situation. So it's having a very, very clear plan, I think, is what works the best, and not being cruel or mean about it, but just being firm.
I like that, being firm, but this is focused on the child. Sometimes the parent is also struggling in their own way.
Of course.
It can be overwhelming. It can be frustrating. It can be stress triggering. What do you also advise parents in the way of handling situations or what to do?
I think you bring up such a good point because a lot of times it is true that the child gets focused on as they're the problem and the child hears this message, but a lot of times it's a family system that is under stress or a family that is in crisis. And maybe we're focused on the child as an individual. But I do really think in situations where a parent is struggling, getting support too. And there is absolutely no shame in getting support for parenting. There is no course we took. Some of us had terrible examples of parenting growing up. You can't rely on them as like, oh, that's what I should do. You're trying to do the opposite, but maybe you're overshooting. And so I really encourage any parent who feels like they are struggling to know that there are resources and there are help, whether it's directly with parenting or maybe they themselves are going through something. Maybe they've had experiences that their child is now triggering in them. There's so many things that can be going on that getting some individual therapy or support for can be so helpful. There is this expectation as parents that we know how to do it all and we're supposed to do it all perfectly, but then no skills or no courses. We don't know. Yeah. You're just you do your best. Maybe you watch some videos, maybe you read a parenting book. And I always say very openly, I have all of the training in the world and I still find parenting to be quite difficult at times. And I'm always relying on asking friends or other colleagues and checking my thinking and decision making. So imagine if that's my situation, of course, everybody else would need some support too.
I like this. I think it's beautiful that you said, like, go and get some support yourself. There is a lot of, and I don't know if you've seen it also, but on social media, a lot of times is don't have children before you're healed or first heal yourself sometimes. And that's a little bit how life is. You have already the children. You realize, oh, I would have needed some healing. But now my child is 2, 5, 15, or maybe even grown up. What's your take on this? Is it really that can I heal and still show my good parenting intentions and skills later on? Is my child picking up on it? Am I doomed to be the bad parent and I have traumatized my child?
Oh, I do love this question because this is one of the huge pieces of guilt I hear from parents. Like, oh, they recognize looking back, I made a mistake and then just sit with that guilt. Like I've caused this. And I feel so much of the time that's really not the case. And we're so hard on ourselves as parents. And there's nothing, I think, more powerful that you can show a child than getting help. And if you recognize that you've struggled with something, you acknowledge it and you get help and you get better. I mean, that is the most beautiful thing you can model to a child. And for them to see that happen just allows them later in life to do the same thing or to tell other people what they've seen. So I would highly encourage any parent to be open about their journey as much as they can. And I think maybe I want to emphasize the one point of just if you have made a mistake or you feel like you did something that was wrong, acknowledging it to your child is so powerful and apologizing and trying to do better. I mean, that is, all of us make mistakes. Some will be big, some will be smaller, but being able to show your child that's how an adult responds is such a gift. So I would highly encourage any parent to absolutely get help, and that it would only improve their parenting, I'm sure, improve their experience of themselves. And there's just always hope.
How is it? And for example, I hear this a lot in my work that people share, oh, my mom has been depressed all my life. She was not present. And I noticed as a child, if let's say you are the depressed parent right now and you're noticing I am depressed, I need help, and you have children already, is it overwhelming for the child to express and say that you are struggling mentally? Or is it what you just said also helpful for the child to understand in a child's language, depending how old they are? Hey, I'm struggling, but it has nothing to do with you. I'm just not able to do what I should be doing, but I love you. What's the best way of dealing with something like this?
Of course, it's going to be age dependent, but I think we don't give children enough credit in that they know something's wrong so much of the time. And a lot of times kids come up with stories and narratives that aren't accurate at all. Like they may come up, like you just said, with the story in their head, my mom doesn't love me. And that couldn't be further from the truth. Their mom's struggling with depression and loves them more than anything and just isn't able to connect things and to be able to correct that, just the same way as if a parent was going through cancer treatment and wasn't able to be at a baseball game because for whatever reason, a mental health condition is the same to me. And so I think it is really important that we are open about it in an age appropriate way and explain that, hey, this is what happens and we get help and we can get better. And, this is some of what mom's struggling with, and just using that example. And I love you and I care about you. And I think that really is the approach that makes the most sense to me. And of course, too, if you're going through something, as much as you can, pulling in a village while you're getting better, and pulling in other people around to help support, just the same way you would if you had a physical illness. But people don't necessarily think of mental health in that way, unfortunately. No. And, food trains don't get started for the mom who's depressed.
No,
started for the mom who has cancer, which of course it should, but it should for everybody. We should support everybody. It doesn't matter if it's a medical illness or what we consider more of a mental illness.
Can you give an example of what would be age appropriate? Let's go with a 8-year-old child who is aware of, mom is depressed.
Sure. With mom being depressed, I think you could sit down and use just a really clear language. Like, you might have noticed that mom has been sleeping more, whatever. Mom has been a little bit more irritable, maybe snapping, hasn't been able to do whatever it is that maybe would be different. And saying, like, I want you to know that mom's sick. Mom, and I can say it like from my own point of view, like, I'm sick and I have a condition, and you can say it's called depression, and I'm going to be getting help and treatment for it. I don't want you to worry. I'm going to be seeing a therapist. I'm going to be taking medication if you are, whatever it is. And I'm really confident that I'm going to be able to get better. But I just want you to know that's what's going on. And I love you so much. I care about you so much. And I really want you to come and let me know if you have any questions or if there's anything you notice. And auntie or dad or whoever else is really going to be, trying to help as well. And using as much specific language, I think, to their situation, and inviting your child to talk to you about it. And then I guess the other piece to it is letting your child know it's not a secret, that they can talk to other adults about it. Because sometimes I find that families with mental health conditions, it's been a secret. Oh, don't talk about dad's alcoholism. Don't talk about mom's depression. It's like a family secret. And allowing your child to talk to their teacher, to talk to the auntie, to talk to the family friend or whoever else it can be to get that support, I think is so incredibly helpful. And if you have that ability to feel comfortable with your child doing that, I think that's another gift you can give them if you're going through something.
That's such an important one, because so many times we think out of protection as parent, we keep it a secret. Also, sometimes to protect our child entirely, we don't share it with our child.
Yes.
But it makes them feel, how I understood it, like they're not taken seriously, not part of the family in that sense. So what happens in the child then? If I keep a secret from them that's related around my health or anything else?
Well, I'll just tell you that they usually know. It's really, I talk to kids all the time, and and mom or dad won't have told them something. And then lo and behold, the kid's like, yeah, I know. And so I really think kids pick up on things and are so intuitive and know us so well that chances are that they know something is going on. They might not know the language or exactly what it is, or they might have jumped to the wrong conclusion. But they really do know. And then it does feel like you don't trust them with being able to tell them the truth. And that's kind of a hard feeling, even if you're doing it to protect them.
They wouldn't see it as such.
I don't think so.
Okay, so the best thing to do is, if we're struggling, to share it in a child's language, like you said, and include them as much as possible, and to normalize it in some ways. Yeah,
there's obviously it's going to be variable depending on what it is you're going through, of course. I don't think you should ever overburden your child with details that they don't need to know, but the general scope of what the condition is and that you're getting help and getting treatment, I think is really important. And always remember too, there's a lot of times that people will pull in a professional for this conversation, right? So if they're wondering like, gosh, I don't really know how to tell my child that I have this condition, it is quite common to have a counselor or a therapist really help facilitate that conversation. I know I certainly have helped families with that as well. It comes up a lot with medical illness, of course, when a parent's struggling with a big medical diagnosis and wondering, how do I tell my child? And that can be really hard because it's very emotional for you as a parent as well to get the words right. And so I think sometimes partnering with somebody else
Helpful.
can be really helpful. And then you make sure I'm getting it right, or getting the level right, or not giving too much detail, or yeah. And so it's also hard.
It sounds very challenging, huh? But I'm happy that there are people like you who help navigate and support parents and children alike. I think that's what you're doing. You're supporting an entire system.
That's the goal.
I have a question.
Yes.
Social media is out there. It's now, the generation of phone. What's a good age to introduce phones to our children these days?
This is such a funny question, because I just went through this yesterday with a friend of one of my own children who has a phone, and they're quite young. So I am definitely of the belief of delaying as long as you can. But I will say there's a difference between a phone, like a flip phone or one of those kind of child-friendly watches to contact a parent, and a smartphone where you have access to the internet and to social media and to everything else. So for the full smartphone, if you can wait until high school, that would be the goal. There's some people that are even saying wait until 60. I mean, if you can do that, please delay as long as you can. They have their whole life to have a smartphone and to be on social media. There's no reason to get it any earlier. It just takes away from some of the magic of childhood, in my opinion. So I suggest delaying, but I think I need to be really clear that if you want your child to have a way to contact you, if they're at a sports event or going over to a friend's house, there's ways to do that without giving your child full access to everything in their pocket wherever they go. So I am a big proponent of waiting as long as you can.
So as long as you can.
As long as you can. Yeah. I mean, realistically, that's high school, I think, is really where your kids will be like, come on, mom, everyone else.
And TikTok, Instagram, and all these, like Facebook, is that something you would also say, wait until you're old enough? Is there... Yeah, because you see the effects that it can have. Right?
I really do see the effects, and I just truthfully don't think that the benefit is really worth it at that young an age. There are some exceptions, of course. There's maybe a child who's a professional in some way, who maybe, is a sports athlete and has a parent managing an account for them, and that's to help with their development. That's a very unique situation that's not common. For the majority of children, I just don't see the benefit that they're going to be getting from a social media platform. Until they're much older, into kind of late teenage years, because there's just so much risk in navigating. I mean, the social comparison's terrible. I'm a full adult, and, sometimes even my experience on social media is negative. Like, how do I expect my child to navigate that? And I always think back and think, gosh, I'm so glad I didn't have this when I was growing up. I don't know that I would have fared so well.
What are the effects on a little girl or a little boy when they see social media, and there's always this Instagram versus reality, but they only perceive Instagram most of the time. But what's the effect of on younger children?
Well, I think it's true that if they don't learn the skills to tell what's real and what's not, and with AI, it's bringing a whole other element into this conversation, because before it used to just be like somebody would put a filter and create an idealized self-image or body image, and you go, gosh, is that what everyone looks like? But now there's news that's been that's made by AI and all these different things happening. So trying to teach children these skills, and it's really hard when they're young. I think it takes a lot of time to really learn what's real and what's not on social media. But the impact, I think, especially on girls, we have research that shows that it affects body image and self-image, especially eating disordered content, really has a negative impact on young women. We know that high amount of time on social media is connected and correlated to rates of anxiety and depression. So if you're spending a lot of time as a young teen on these types of platforms, and some are spending upwards of 8 hours a day on social media, that is not unusual anymore.
Okay.
Constantly on.
It's a full workday.
Completely. Yeah. They should be sleeping. That we know this has these impacts. And on young boys, it's interesting too, because it absolutely does have impacts on them. Video games can be one where they really do seem to be spending more time on, as opposed to girls on like the social media, more the image-based sites. Okay. And then with boys, of course, the concern that's come up is a lot of the negative content that they're being viewed, that's talking more about like misogynistic views and different worldviews, and some of the really negative content that's coming out that's really geared towards young men and young boys at a time when they're developing kind of their sense of self and their sense of the world. And that's really quite concerning. And how do you protect young boys from that type of messaging that's out there? So I think the longer you can delay, and in doing that, before they get onto any of these apps, just really teach the skills to navigate. What are you going to do if you see something that's disturbing? What are you going to do if somebody is bullying you online? There's a lot of things that you have to go through with a child before you give them access, even just to the internet, but to social media specifically.
And is there sort of a good time to allow, like, let's say, an hour a day, 30 minutes a day to be on the phone, on social medias, on the game? Is there a sort of recommendation for parents out there? What's okay?
Yeah. Again, it's like, it is individual to the child. There's some children who love being on social media, and there's other children I meet who don't want anything to do with it. But I think in general, not too close to bedtime is kind of a key.
Okay.
You don't want to do it before bed. You get bombarded. The lights affect your sleep cycle. So if you're going to have them do some time on any type of screen, you'd want it earlier in the day. And ideally, you'd have them do it in a supervised way. Maybe you're sitting down next to them, seeing what they're viewing, or co-viewing with your child, seeing what type of content are they being fed? What do they like about it? What don't they like about it? And then while you're seeing what they're doing, you can try to teach them about some of the privacy controls. If you don't want to see a certain type of content, most of the apps allow you to filter that out now. So there's ways to kind of put some safety protections in on a lot of the apps. But it's still very challenging, and that requires a lot of time from a parent. And I know a lot of parents, it's like the screen time is the time when you get to make dinner, or you can quickly do your work phone call or check your email. So it's hard then when the ask is to supervise it so closely.
But it's the best, the way I took it, not to allow it unless you have the time to sit next to them or have a monitor, which is an app.
Or you feel like that at the age and the maturity, and you've taught them the skills that you feel confident that they can manage that on their own, which for a lot of children really isn't until they're hitting closer to 15, 16 that you could feel like, okay, I think they have the skills to manage this. With younger children, especially the 12 to 13-year-olds, I mean, my bias is I see the children who have all the negative effects and struggle with it. So I certainly, for my own kids, want to delay it as much as I can. I just think there's so many other things to do.
True.
But it's hard.
It's hard. It's really a battle. Right? That's also what I see in schools. The kids have it all. So it becomes, children start comparing themselves to others and feel like they don't have what others have. So it becomes a huge thing to navigate for the parents out there.
Absolutely. Yes. I'm going through it myself. Like I said, I was out with a very young child who had a phone the other day. And I was shocked. So I had to have the conversation a little earlier than I expected about how, different families have different rules and different expectations and different priorities, and that's okay, and how we're going to manage that.
Wow. Yeah. And these are sometimes tough conversations to have.
Conversations for all of us. Yeah. It's not easy you want to provide your child with everything you possibly can. It's hard when you're saying they can't have something that someone else does.
Willow, can I ask you, what's the most rewarding thing about your work for yourself?
I think it's seeing the recovery and seeing the remarkable turnaround. I really have had such amazing turnarounds with patients and with people I've met over my career, where in the moment that when we first met, people would think, gosh, I don't know that there's much that can be done for that situation. And then following somebody over a few years and them exceeding all expectations, and that there's so much hope in our work, and recovery is so possible, especially for children. It is for everybody, but especially for children with support. We have excellent treatments for mental health conditions. And I wish more people knew that because I get to witness it. And it's such a joy, and absolutely the most rewarding part of my work is knowing that, with the right support, with the right treatment, we really can turn someone's life around.
I'm going to ask the other side of the coin. You don't have to answer it. When the most frustrating thing about your work?
Oh, the most frustrating thing is the systems that we work in, right? So sometimes there might be a treatment that you really want for a child. Let's use that as an example, but an insurance company won't pay, or the treatment is only available in a different location than where the child is, and they're not able to access it. So for me, it's coming up against the systems that is the most frustrating part of my job. I still do it, but it's definitely the part I like the least.
I can imagine that's pretty much a global issue. I see as well. I ask everyone who comes onto my podcast, if you could travel back in time, and it can be any time into your past, from childhood, teenage years, or yesterday, but you can speak to yourself and give yourself a piece of advice, where would you go and what would you tell yourself?
Oh gosh, that's such a powerful question. I love it. I want to be thoughtful about it. I think I'd probably go back to my teen years and probably right around the age I was just talking about being difficult, the 12 to 13. And for me, myself at that time, I was doing a lot of schooling and making a lot of sacrifice and sacrificed a lot socially for what I was doing and reminding myself that it would be worth it and that my time would come and, I'd get to do all of those things just at a different stage in life than maybe what I was seeing my peers do. And that, it's a cliche, but that especially for young people, things do get better. And reminding myself of that message, I think probably would be the most meaningful thing to do. I mean, there's been some amazing meals I'd go back and have again too, but
that's a beautiful message. Yeah. I like that. What I hear is also you individually have your own timeline. Don't follow the one that maybe society has created. And a lot of times we as teenagers, young people, but still as adults, we compare our milestones and you're saying, no, you have the time.
Yeah.
That's beautiful.
You summarized it perfectly.
Thank you so much, Willow. Is there anything now you can speak to people who are out there who are struggling, who maybe struggle with ADHD or with their mental health, based on what you've witnessed in your work that you really would like them to know?
Oh, my biggest purpose and my mission, especially when I do work on social media, is for people to know that there's always hope and to not give up. And if anyone out there listening can just hear that and believe it, because I say it with all of my heart, I really believe that to be true. And I really ask everybody to reach out, even if it feels like you're reaching out just one more time, because things can always get better.
That's such a powerful one. That's so important. It can always get better. And there is that glimpse of hope that you should really go for. Because on the other end, there might be waiting something actually beautiful for you out there. Willow, thank you so much for being on my podcast. This will be not the last time, I know it. So many more questions, but thank you for being on my podcast. Thank you for sharing your knowledge. And can you tell us, please, where can people find you?
Yes, well, we talked about social media. You can find me on social media. So I am on most platforms at Dr. Willow Jenkins, and I'm pretty easy to find and love to connect. And yeah, would love to talk and connect with more of you.
Please make sure that you follow Willow Jenkins, Dr. Jenkins, on her social media. She's doing incredible work out there, and maybe you can relate and maybe you want to work with her. So follow her website, her Instagram, and check it out. Please share also with me what your main takeaways were from this wonderful and powerful episode. And don't forget to subscribe to Real, Raw, and Authentic to allow me to do more episodes with amazing experts just like Willow. Thank you so much for watching this episode. Please take good care of yourself, and I'll see you in the next episode, wherever that's gonna be.